Okay, I have 6:15. Unless there's I'm going to open up the November 2nd meeting of the Chelmsford Board of Health. Our first order of business is to approve the minutes, so I'll give people a few moments to look over that.
I'll make a motion to approve.
Second.
Okay, all in favor?
Aye.
Aye. Unanimous approval.
Okay.
Our next order of business is the correspondence outgoing.
Yeah.
Michelle, what does the LAA mean? At Grace Street? Oh, that's an in-law apartment. Is that what that is?
Where is that? Under what?
Yes, it is. It is.
Okay. All right.
Whatever it stands for now. What does LLA stand for now?
Limited accessory apartment.
Oh, I see.
Okay, so I assume that there's no particular problems with sewage or anything like that for these are being existing structures,
Right.
correct? Okay.
Yep.
So I will entertain a motion to accept if.
I'll make a motion to accept.
Second.
So Richard's number motion and Anne Marie's the number 2.
I
With
guess.
that,
Yes.
say aye. Aye.
Aye.
Aye.
Aye. So in that case, our next item is the incoming correspondence. Was there any particular reason that we have Chelmsford and only North Chelmsford Water District results?
They submit it to us every year when they do this. It's typical report.
So it's not that the other districts are lacking, and it's not that there was an issue with lead, copper, et cetera.
No,
No, I don't think so.
no, just they do it annually and we get it, the different ones throughout the year from the different water districts.
Yeah, I was around when they first started the program. DEP basically was reaching out and sitting there, wanted to, quote unquote, see whether public buildings, particularly schools and whatever, as everybody complained as normal about the taste of the bubbler, kind of thing. And they basically started a nice program to support the different water districts and whatever to go out and do this testing and get results back and see where there's issues or not issues and whether maintenance can reduce the numbers or whether there's actually some physical problems in some schools. I mean, luckily, even though we do have some older schools and some older buildings, we're not a city of kind of thing that have buildings that are 100 years old kind of thing. So yeah, no, so it is a routine thing, and it's showing that the system is working and things should be, move forward pretty well. So.
Okay. Well, I'm open to a motion step when people have.
I'll make a motion to approve.
Second.
All in favor? Aye.
Aye.
Now on to old business. The first item is COVID updates. And I assume that that's probably from Sue today?
Yep. So at this point, what we've been doing is we have been updating our website every Thursday We were actually updating it on Thursdays, and then starting last week, DPH started coming out with their numbers on Thursdays as well. They used to come out on Wednesday and they would designate the different communities, the different colors. And starting last week, they switched that day to Thursdays so that all the information would come out at the same time, the state numbers as well as the school numbers, long-term care numbers, that type of thing. So as of last Thursday on our website, we have a total of 618 cases. 568 of those were confirmed, 50 probable. We were at 51 deaths last week. And at that time, we had 35 active cases. And of those 35, at that time, we had 24 in the community and 11 at Sunny Acres. As you all know, Sunny Acres unfortunately experienced a cluster and an outbreak over there that they've been battling for the last 3 or 4 weeks. Finally, they have turned the corner. Thank goodness for them. They've had DPH in there since day one, working with them. And I'm just trying to find, as of today, I believe they only had, one of my piece of paper here. I want to say it was 9 cases that were still active, and they had tested residents and staff the end of last week, and all of them came back negative. So they're on the other side of this, thank goodness.
Can they trace this to some specific event?
Well, if, in talking to the nursing director over there, it was an unfortunate situation where they had taken in a resident from another facility. And my understanding in talking to the director of nurses is that, and the executive director over there, is that that individual had tested negative on 2 separate occasions prior to being admitted. And then they automatically put people in quarantine and test them, within the first 24 or 48 hours when they get admitted. And this individual was in a room with another individual, tested after admission and tested positive after having tested, negative twice, and I believe minimal to no symptoms. And then it just kind of went through like wildfire. It hit a lot of their staff. It hit some of their staff either hasn't returned. I know at least one staff member is still out because they're still having some repercussions of the illness. But I have to commend them, because as awful as it was with what they went through, they kept in touch with us on a regular basis to keep us informed. They reached out to the rapid response COVID team at the state, and that team was in there from day one, helping them out as far as control and all of that. So,
And then they still lost 11 people.
yes.
I mean, that's just unbelievable. They were doing well up until this.
They lost 11 people was the total that they lost since March. This last round. So they got hit much harder this round than they did in the beginning.
Right. Yeah.
This round they lost 7.
Okay.
They lost 4 the first round back in March, April. So yeah, they got hit pretty hard.
So I was just going to ask, so given how sensitive these communal living centers are, there's not a rule to have these new residents be quarantined for 14 days. I mean, I know that, like with school and work and everything, when we're advising the kids that if they're exposed, it doesn't matter what their test result was, they have to quarantine for 14 days before they return.
So
it's not.
So these, I believe that the 2 individuals that shared a room, I believe they both came in at the same time.
Okay.
So they were in quarantine and they got tested during that period. Don't quote me on that for sure, because it was, I really tried to get the information that I needed from them at the beginning without really bothering them too much because they were so bogged down with trying to manage everything that was going on.
Mhm.
But if they were in quarantine, then how did this extend beyond those two patients or two residents?
Was it staff?
I believe staff. I believe staff got it as well. And as much as they were doing, oh, sorry, that's my dog.
But mask and dog.
Hold on a second.
Is that your dog or you? I thought she was getting Zoom bombed by a dog.
Yeah, yeah. Now, your own dog usually is better at it than somebody else. One second. All right.
Welcome back. So, oh, you're on mute.
Sorry.
No
That's-
problem. So, was staff appropriately? Did they have appropriate respiratory precautions?
Yes. Yeah. So when I
Okay.
talked to the director of nurses over there, she said that her opinion is that this was definitely a mutated form, that because she felt that the way that this went through their facility with all the precautions that they took was very different from the first time around.
That's not good.
No,
No.
no. So I'm just very happy for them that they are on the other side
Okay.
of this.
So the protocol is that any new resident is quarantined for 14 days when they come in, and the staff does go through the appropriate precautions whenever they're exposed to them in that 14 days.
Oh, yeah,
Did
and
they-
they had, like I said, they had the state rapid response COVID team in there with them right from day one. So they helped them put into place any extra precautions that they needed. They helped them out with extra intensive testing and all of that. And I do know that across the state, there have been new guidelines that have come out as far as long-term care facilities. I believe that it's recommended that you have no more than 2 people to a room now. So different facilities have had to change that up where sometimes they would have 3 and 4 in a room.
And the pre-testing, that was PCR each time?
Yes.
Okay.
Yep. Yep.
So,
We had, did you have another question, Eric?
No.
Oh, okay. We had, that we were able to document, we had 41 complaints. I am going to say we definitely had more than that because,
COVID?
yeah, COVID
Okay.
complaints regarding non-compliance and enforcement issues. We definitely had more than that we've had to follow up on. And honestly, we just couldn't track them all because we don't have the time to track them all to actually write them all down. We got numerous phone calls as soon as we went into the red zone. And it was trying to explain to people, you know, why we were in the red zone and putting out the new guidance from the state that if you're in the red zone and you have a little asterisk next to your name, that indicates that 30% of your numbers are from one particular location, being either a long-term care, a higher ed institution, or a correctional facility. So if a community has 30% or more of their cases in one of those facilities, you do have an asterisk next to your name. So if you looked at Chelmsford the last couple of weeks, we had the asterisk next to our name. So we've definitely seen an increase in our cases. I want to say we got 8 or 10 over the weekend alone. And I think across, it's, you know, it's public knowledge out there that we are seeing a number of increased cases across the state of Massachusetts, which is why the governor came out today with his, you know, public announcements and updated all of the orders. So we have not had a chance. We will put those links out on our Chelmsford website, a Board of Health page, and we'll also put it out on our Facebook page because the governor did update the order for masks And that new order consists of the fact that there were 3 different orders. So there was an order revising the gatherings, an order revising mask wearing, and then an order revising the gatherings. And essentially what they did, if we talk about the mask order first, is that was updated that anybody has to have a mask when they are out in public, period. Any place in public, you have to wear a mask. So, you know, you see people that, let's just say you're outside, you're in a pub, indoor or outdoor. So you see people, they come out of the grocery store all the time. First thing you do when you come out of the grocery store, you walk back to your car, you take off your mask. Technically, you can't take off your mask now until you get back in your car. And business owners can, in fact, refuse entry to people who will not wear a mask if they do not have a medical exemption. The other thing that the mask order does is for employers, where you have a business where your employees are supposed to be wearing masks. If one of your employees says that they have a medical exemption for not wearing a mask, the employer can get documentation from that employee, from their doctor, as to why they can't wear a mask. Because we're in the middle of a pandemic, and you know, the rules are a little bit different with a pandemic. So essentially, anytime you're not at home, in your own house, in your own car, you need to have a mask on. If you're
Does it say anything about lunch and break rooms?
it's the same. I don't believe they changed that, Eric. I believe it is the same as far as lunchroom and break rooms. You still have to be at least 6 feet apart to remove your mask in order to eat. And literally, I got, you know, he was on, I think, at 1:30, and I got this, you know, mid to late afternoon. I'm just trying to flip through it to see specifically what it says about eating, if it even does. And this is a civil fine for enforcement by Department of Public Health, local Board of Health, as well as state and municipal police if necessary. And it's a fine of $300 per
Wow.
violation.
So what does it say? We talked about bicyclists, runners.
They have
No
to have a
exemptions?
mask on. So
Restaurant,
before, they didn't necessarily have to wear a mask, because it was, if you were not going to be within 6 feet of someone
Right.
for an extended period of time, then, you know, and so we would get people all the time that would comment about the bike path and Freeman Trail and all of that. And by all technicality, if you were moving constantly, you didn't have to have a mask on.
Right.
Now you do. Now
What
you
about
do. So
restaurants and in the schools, the mask breaks?
they have to be 6 feet apart.
Okay.
So
What about restaurants?
same thing. Restaurants, you can, you know, you can only take your mask off when you're eating, once you get to your table. You get up to use the ladies' room, men's room, whatever, in a restaurant, you have to put your mask on.
I thought that was always the case, though.
That it is. Yep,
Yeah.
that hasn't changed. So that was the mask, the face covering one.
But Sue, didn't they recently come out with something about these masks that have the vents?
Yeah,
Oh,
that you shouldn't wear them.
Right, I see a lot of people wearing them.
They really
Yeah.
should not.
And they're not supposed to wear them because they're not effective,
Hmm.
you know. Now, if we go to, let me see the other one. I went through these real quick and tried to highlight. So this one was early closing of businesses and activities, limiting hours for alcohol and adult use sales, and modifying license renewal. This is mandatory nighttime closing period for businesses and activities. And basically everything has to be closed from 9:30 at night till 5 in the morning. Now, if you own a company where you have employees in there and they're working and it's a night shift or whatever, then they can come to work. But this is more restaurants, bars, arcades. There's a whole list. Businesses, facilities, and activities subject to the mandatory closing. Arcades and other indoor and outdoor events, theaters, performance venues, movies, youth and adult amateur sports, golf, recreational boating, outdoor
Did you
recreational.
say golf?
Yeah. I don't know many people who golf between 9:30 p.m. and 5
I
a.m.
mean, no ball goes in the dark.
And I'll correct it. It says golf facilities, so maybe they're thinking of people at the bar at the end of the day. Casinos, racetracks, driving and flight schools, close contact personal services, fitness centers and health clubs, because I know some of them are open 24 hours, and that's going to affect some of our local fitness centers who I believe stay open till at least 10 or 11, or some of them 24. So they list everything, and then they talk about restriction of the sale of alcohol and restriction of adult use cannabis during these same hours, closing these during the state emergency. And the enforcement for this order is $500 per violation. And it's the same enforcement: public health, Department of Labor Standards, local board of health, and state municipal police. So that's the mandatory closing. And then the third one that he did was the social gatherings. And this is going to be challenging, but I understand why he did it. More and more people are having gatherings. The holidays are coming. You know, we're seeing these increase in numbers, and it's a means of trying to keep things open and functioning without us going back into a shutdown. So trying to control the spread. And essentially, as far as the limit to gatherings, it is for all social, community, civic, public, and leisure events, as well as conferences, conventions, fundraisers, and other similar events or assemblies, and members of the same household, when assembled together with no other non-household members present, do not constitute a gathering, and they're not subject to that. However, so if you have a household and you have 10 people that live in your household, then you're not subject to a gathering limit. But anybody beyond those 10 people that live in your household, you would be subject to. And there they go so far as saying, in addition to the capacity restrictions, all indoor and outdoor gatherings, including gatherings at private residences, must maintain at least 6 feet of physical distance from every other participant, except where participants are members of the same household. And a gathering will violate this provision no matter the number of participants present, if it is not possible for participants to remain 6 feet apart. So private residence, maximum of 10 people.
Well, there's a constitutional challenge coming.
Oh, yeah.
I know.
Can't come
Well,
into their house.
Well, I was just going to say that, and you know, it's an enforcement nightmare as far as
Right, it
how,
could be enforced.
right,
I wouldn't even enforce the one on the residents. That's
you know,
crazy.
it says indoor gatherings at private residences and in any other place not falling within the definition of an event venue or public setting are limited to a maximum of 10 people. Outdoor gatherings at a private residence, maximum of 25 people. And then if you're at a event venue, public setting, indoor gathering is 25 people. If you're in a low risk community, that can be up to, low risk community could be up to 100 people at a single venue. I mean, it's just, and it breaks everything down versus lower risk community, private, public. And everything has to, public restaurants, all that, clubs, bars, anything like that has to be closed by 9:30 at night. And then it talks about, it reinforces the face coverings when you're in
What's the
public.
logic with the 9:30?
What do people do outside after 9:30?
Exactly.
It's too cold, Eric.
No, inside, but think about the restaurants and all that that are open past 9:30.
They're not eating, they're drinking. And if they
They're
drink,
drinking. And then, you know, the alcohol takes over, they're taking their masks off, and I think that's my opinion. I haven't spoken directly with the governor or, you know, anybody at the state level. But that's what I think their premise is. And then they basically go on to talk about the masks again, and that they're encouraging it at all indoor and outdoor gatherings, but are only required if it's more than 10 people that do not include household members. And then they go into the whole enforcement for this one. And this one is $500 per violation. And what I find interesting with this one, and it's the same enforcement as far as DPH, local board of health, state municipal police. And it talks about each person. So if you are fined for a gathering enforcement violation, each person over the permissible gathering limitation may be treated and counted as a separate violation. And it's $500 per violation. And all of these go into effect at 12:01 a.m. this Friday, November 6th. So I think that was a lot for him to come out with today. I'm sure we're going to get some questions. We're going to get some questions on it, and some calls on it, and we will do the best that we can. But I don't.
if your friend comes over to your house and to drop something off, and you're technically within 3 feet of each other, technically that's a $1,000 violation right there. By the way, this is written.
No, it's a gathering. It's a gathering.
Okay, but it's still, people need to stay 6 feet apart, or what's the fine if they're within 6 feet? Not that I think that we're going to send people door to door.
Well, the recommendation is the 6 feet apart. The violation is really the gathering numbers.
Okay. Okay, I'm not sure I can repeat any of those numbers that you just told me.
Yeah.
And
I know.
I don't know how in the world that would be, enforced unless something's complained about.
Right, and that's exactly it, which is why we will put it on our website. We'll put it on our Facebook page. I'm sure, the news media, once they, I don't know if they've covered it today. I haven't watched TV at all other than watching the governor. So I have no idea with the election being tomorrow, I don't even know if the media will put anything out there about, what the governor has said. And at the very
I
least,
think there might have been an announcement, Sue, because one of my paralegals came in and talked to me about it.
yeah. So, I mean, it was on at 1:30, and then I know they covered it a little bit after that. So I would hope that it would be on the local news and they'd put it out there for people to go to the mass.gov website and see what the most updated guidance is. But it is a lot. It's a lot to figure out, sort out. And of course, our office being, charged with all of the enforcement is just another logistical nightmare with the limited staff that we have. We're doing the best we can, and we continue to do the best we can. From the beginning, we've really tried to, when we get complaints, we really try to educate people, and that's still what we continue to try to do. But if we have repeated offenders and repeated complaints, which is, another item on our agenda tonight, those are the people that I do believe should be fined.
Okay.
Okay.
And dumb question, because I don't know that I want to go there, but we have no, we don't have the ability to require a permit for gatherings of various sizes.
No, no. There is some specification in the gatherings order that I didn't go into reading it, but there is specification in here that if you are having a gathering, for an outdoor gathering, if you're a low-risk community, and you're going to have more than 50 people, because if you're low risk, you can have, and it's outdoor, you could have up to 100 right now. If it's going to be more than 50 people, the operator of the event venue is supposed to notify the health department where the gathering is located a week in advance, and then, or otherwise as soon as possible if a week is not practical. And then for outdoor events that are being held in public places like parks, they want, and it's going to be more than 50 people, then the person responsible for providing the notice to the health department is supposed to be the event organizer. Again, most people aren't going to know that unless they specifically read through every guideline. And if we hear of an event, we don't have the capacity to chase down all these people and say, you know, oh, how come you didn't call us? We'll follow up. You know, again, if we get a complaint or if somebody is concerned, then we'll reach out as best we can.
Okay.
Okay.
I was just going to, with regard to coronavirus, unless you have more on this subject,
Nope.
the hospital's been at a level 2 for about a month now. That's typically when they're about 10 to 20 patients. It's a lot. It's way down from the peak, but it's about twice what it's been for the previous month or two. In general, they're less acute. We have a lot fewer people in the ICU and a lot fewer people on ventilators. My sense overall from the national statistics is that the death rate appears to be dropping, where it was about 3.5% back in March and April. It seems like it's down less than like 1.5% now. And my only concern about that is that, you know, these respiratory illnesses in the United States seem to settle into the adolescent population, which becomes a reservoir. They don't do so poorly with it, so that they might, you know, have better survivability. So part of this is probably that we have better therapies, you know, when people identified and in the hospital. And part of it is that we might end up with sort of a reservoir population that isn't as sick. And I think in recognition of that, I can't remember if I said it last month, but the CDC put out the 4-tier, you know, who gets it first, second, third, and fourth. And it was actually a very thoughtful document. It's a little bit difficult to try to summarize. But you know, number one was sort of people at risk in group living situations like elder housing, as well as first-line responders. But I think in group 2, they included kids, not because the kids are the highest risk, but because the kids are the ones that sort of then pass it on to the other groups. And otherwise, with regard to testing, we've been seeing a problem with the quick tests that are done by a limited number of the urgent care centers, because it turns out that if your test is positive, that about 30% of those are false positives. And the problem we've had mostly with the Emerson Urgent Care, where people will test positive on the quick test, down the bus, they'll shut down the classes, and then the next day the PCR test comes back negative, and the school doesn't know what to do. Of course, you know, you have to repeat that PCR test 24 hours later after the first one. And if it's negative, then the patient was negative all along, but it's led to a lot of confusion in different places. The other problem we're having with tests, it's not the COVID test, but the flu test. According to Adam Weston, the infectious disease doctor over at the hospital who's been in charge of their COVID response, he was saying that this year, for whatever reason, the 60% of the positive flu tests by quick test are false positives, which means that if you test positive with the quick flu, there's less than a 50% chance that you actually have it. And that's part of the confusion is that when you're trying to sort of parse out, a patient with fever and cough, who's got COVID that we need to isolate, quarantine their exposures, et cetera, then it gets really confusing when you have all the tests that you can do for both COVID and and flu, if they're so poor at being able to specifically and their specificity and sensitivity is so poor, meaning that they have so many false positives and so many false negatives. And it can be difficult to find a flu vaccine. We have not been able to purchase any more for our patients who are over 19 years old from the private supply. We can still get the younger stuff, the stuff for the younger kids from the state, but doctors can't buy privately the regular flu vaccines.
I looked into trying to purchase some more of the regular quadrivalent flu vaccine as well for the health department, and the supply is just gone. So hopefully people have gotten it, whether it be pharmacies, whatever. I mean, we still have some clinics coming up, so we still have some supply, but I think this is going to be the first year in several years that I'm actually going to use my whole supply, which
Wow.
I haven't actually used my whole supply in a long time. And the other thing that I would like to use just this extra couple of minutes for, as far as COVID updates, is to remind people in the community that if you have symptoms of COVID and you are going to be tested, while you are waiting for those test results, you should be home in isolation. We have people who, and when we're doing case investigation and case follow-up and stuff, we're finding that people don't feel well. Their symptoms maybe aren't severe, they might be mild, but they go to get a COVID test. And during that, 24, mostly 48 hours that they're waiting for that PCR test to come back, they're not necessarily staying at home, isolating themselves, waiting for that test result to come back. And then when all of a sudden, 48 hours later, we get a positive test result, they've continued to potentially expose all these people that they were around in that 48 hours. And if you can, it is recommended as best you can to even isolate from other members of your family, because that's where we're seeing the spread is within households. It's just an area where we see a lot of transmission is within households. So if anybody is symptomatic and you get tested, you're waiting for the results, isolate if you can from the rest of your family.
And of course, the other problem we're still having is if someone is exposed to a known case, you're quarantined. That's 14 days. You can't get out of that. It doesn't matter what your test results are, because you could turn positive at any point.
Correct.
By the way, with regard to flu vaccine supply, there's a mandate that everybody has to have a flu vaccine, or all kids have to have a flu vaccine by December 31st. There's a lot of resistance to that, and we're coming up with short supply. So I'm not sure what's going to happen with that. I'm also hearing, because people are getting, because of mixed messages that they've heard, there's a larger and larger group coming up opposed to a COVID vaccine for when it comes out. Even people who are generally amenable are thinking they might wait a year before they get it. I'm thinking that in terms of the pros and cons, there's a lot more risk for a real virus that's out there than a vaccine that's been vetted out. It's slim with the vaccine, it's real with the COVID virus.
Mm-hmm. Yeah. We've actually just scheduled our school-based flu clinics for the 2 middle schools and the high school for next week. So that notice went home to all parents in the middle schools and the high schools to pre-register their children with us at the Board of Health. And the issue this year, which is different than every other year, is that we have to go to each school twice because of the cohorts. So students are in school either Monday, Tuesday, one group, and then the other group is in school Thursday, Friday. So in order to get one school, we have to go twice. So that's a bit of a challenge, but we are planning pretty much every day. Next Wednesday is Veterans Day, but Monday, Tuesday, Thursday, Friday, we'll be in the schools doing the students. As many who sign up.
Okay. Do we have any other announcements or comments or questions with regard to COVID-19?
No, the only question I have is statistically, are we just, of those that are showing positive, is there a higher percentage of people that are coming back with a positive test that are asymptomatic? Has the numbers gone up, or do we know that? I guess is the other question. Do we know every time someone becomes positive by test results, at that point in time, are they asymptomatic, low? No, I'm not talking about what mild symptoms or severe symptoms, but do they actually collect that data to sit there and say, these people are testing positive and they're showing nothing, zero?
So I believe that the state is collecting all of the specifics across the state. We
Okay.
have found doing our case follow-up, when Darcy and Amanda are doing the case follow-up,
Okay.
we have that we are seeing cases who are testing positive because they've been told to be in quarantine, they're a close contact. We recommend, based on DPH guidelines, that they get tested on day 4 or 5 after exposure. And we're finding that some of those people are testing positive without symptoms. And then others have very mild symptoms that have started around that time. And then of course they're not in quarantine and then go into isolation because they've tested.
Okay. All right. Thanks.
Okay.
That's it.
I'm all set.
Should we move on to Newport Increase?
The only reason that we put that on the agenda is we just wanted to, announce again that we did get a copy of the Westford Air Quality Study, and we did post that on our Board of Health website. I checked again on Chelmsford's results, and the report is actually still pending. I do believe that it's supposed to be ready within the next couple of weeks, and again, it will be presented to the select board, and then we'll get a copy of the results. We'll put it on our website, and the company has agreed, and I guess it would be based on what the results were, depending on what that is, but they had actually offered to present at a board meeting if we wanted them to compare the results from Chelmsford study and Westford study.
That's a good idea.
Which, we can have them. I do know that with the Westford study, they predominantly went by the request of the residents in Westford as to where they would test. And most of those areas were in the areas of the schools. And there's really not any school super close to Newport Industries. Whereas, we had asked GZA specifically to test certain areas in Chelmsford where we were seeing all the complaints. And of course, I don't think the company has actually shut down yet, but with the weather change, knock on wood, we haven't had the number of complaints that we were getting before.
Has Westford had the number of complaints that we have?
Westford's had 0 complaints, according to their health director.
Do they
So
have?
it's all about the way the wind's blowing.
Yep. That's it. That's always going to be the issue. Always is and always will be. Which way is the wind blowing?
Okay. Sewer contract services?
Last month, when we presented with the fee schedule, and we talked about the two different contractors that Michelle had reached out to. And I remember at the time, Anne Marie, you had mentioned, well, why couldn't we just have two different companies
Yeah,
and reach out? So, and I'm going to let Michelle address this more specifically, but apparently, in the world of sewer contracts and soil testing and doing the stuff that we're going to need a contractor person to do, you typically reach out to a particular company asks to have a signed contract. And the benefits of that signed contract is that when we get a request in, by signing that contract, they basically agree with us that they're going to be, for lack of another word, kind of at our disposal to make sure that they're available to get that job done within a very reasonable amount of time, not let people wait and all that. So between Michelle and Rich, they had meetings with two of the people that we got proposals from. They also sent in some paperwork as far as some of the letters that they would send out to their boards of health as far as, so the first one I believe is from Mill River, and he gives us examples of an approval letter, a disapproval letter, for different things and basically what they would do. So I'll just let Michelle explain all of that.
So I reached out to both of the James Moran and Dan Ottenheimer. You can see Dan Ottenheimer's packet. He gives you a whole plethora of information. This letter that he would send to us, and we would sign off on it. And then after that, there's a disapproval letter. I asked both of the people for exactly the same paperwork to show you. And I think Mill River is a little bit more. So there's also an on-site water system construction notes. This is the form that not only I would use, but so would Mill River. So we would, my inspections are on this form, as well as the contractors' information. The next the next part of that packet are the details in the perk tests. This is what we would receive in the office to know exactly where the groundwater was, exactly where they put the system in the yard. And then Mill River also sent in a drawing of plans that they would be reviewing. So all of this sort of goes together in one septic system. The next one is James Moran, and as Rick and I had asked for exactly the same information, and this is what Jim Moran sent us. He sent us his resume along with another engineer's resume in his office, and then he sent us an example of his approval letter. I received this a couple days ago. Okay, and then after that, there is the septic price. So there were a few prices that we still wanted to get, and this is up for your approval or disapproval. You can take a look at it and let me know what you think.
so are you saying that we can only have one?
I think it's a better case scenario. We don't want to get into a situation where we have two competing engineers on site. And if one of them can't make it, then, what do we do? And, it goes back. So a contract with, say, one of these engineers, we would put in our contract that we want them, when it comes to a soils evaluation, we would want that contract, our consultant, to reach out to their engineer, the other party's engineer, within 48 hours of receiving the application. So then he would, he would schedule his soils with that engineer, and that would be in the case of maybe 2 weeks or 3 weeks, whenever the other engineer could do it. So it's a series of events that need to take place, and I worry about the competitiveness between 2 different contractors. I've never heard of it done. I'm sure it could be done. Anything is possible. I can tell you that between the 2, and Rich, you can
Yes, yeah.
chime in if you would like to. Between the 2 contractors, Mill River was definitely produced the information quickly, efficiently. You can see the difference between the 2 packets. And that's what we want. We want someone that's going to react, that will get the job done. Whereas I think Rich and I had more of a difficult time with the other, the other party trying to get it all in and get what we needed to show you people. So, and it wasn't really a complete packet. So we're looking for, obviously, the best engineer that we can possibly get on board. And that would require a contract.
Can you get out of this contract?
Say it again?
Can we get out of the contract? Is it a contract for a year? Or is there any sort of a escape?
They're 3 years.
For 3 years?
Usually they are. I'm sure we could base it on something else, Anne Marie.
No, I've never seen one of these contracts. I guess if it doesn't work out, how do we get out of that contract? I don't want to be stuck with, although I agree with you, Mill River's presentations is very complete here.
Well, maybe we could have a clause in it if
Yeah, we got to look at it.
Lack of performance.
Yeah,
And
something like that.
Absolutely, without a
Okay.
Yeah.
So I'd be in favor of Mill River.
Yeah, I mean, definitely after the discussions that we had with it, clearly Mill River was, at least to myself and also to Michelle, I think they're both competent, but I think experience-wise in dealing with it, and particularly dealing with the potential for secondary treatment and things, that might come down to
that we want.
Yeah, was clearly there, but also too the issue over, 1 contractor, 2 contractor. I mean, I think, how do I want to put this? I don't see, and maybe I'm wrong, but I don't see that there's going to be this myriad of potential. And again, of course, it depends on how we create this regulation and sort of where the board draws its line on certain things that we had previously talked about. I don't see that there should be an awful lot of lots and or developments that are going to be coming up in let's say a calendar year. I don't think we have the land. I don't think we have the areas, particularly the areas that aren't sensitive enough, where potentially the board will be sitting there saying, no, it's either sewer or nothing. In zone 2s, you're not building these things on septic and us going backwards without something happening. And pretty simply, all these areas that are in the zone 2s are probably 99.9% developed. So it's redevelopment, and it's nothing that's guaranteed to anybody that someone can take an existing piece of property that has a certain designated amount of sewage capacity going to it, and they have this right that they can sit there and say, well, I want 5 times the capacity now that I'm going to be doing something different. So, but clearly, I think one single contractor would be easier to deal with, and I really don't know whether there's going to be this huge myriad of work, depending on how we, what I call, color the scenarios in which septic is going to be a reasonable option and or treatment, and what sections of town are going to fall into that category.
I would probably suggest that we ask, yes, it might be typical to do a 3-year contract, but because this is something different that
Mhm.
Chelmsford hasn't had to deal with for, for many years, we could reach out and, ask. I think if the board takes a vote to go with Mill River, we could put it out there and ask if we have a 1-year contract to start off with a 2-year extension at the completion of the first year satisfactory to the board. I think that would be very
Yep.
reasonable, and I don't see any reason why they wouldn't agree with that.
I think that's very reasonable. So
Mhm. Yeah.
when Rich and I were talking to the two parties, I think we both felt that the type of systems that we want in Chelmsford, the pretreatment system, it seemed like Mill River was a little bit more qualified and has a lot of experience with those types of systems. And I'm not saying that James Moran's company didn't. I think that they both are qualified to do the work. However, it just seemed that Mill River was definitely, they do a lot of work in Essex, they do a lot of work in Gloucester, they do a lot of, high groundwater type things, all systems that need, potentially need a pretreatment program. So that's sort of where how Rich and I felt about, the two of them as we interviewed both of them.
Agreed.
And I think that that's fine. 1 year, and I can certainly discuss that. Is there anything else in discussion that you would like?
I think we need the board to vote on which one that they would.
I have a couple questions. The first is, are these exclusive contracts? If we sign 3 years and we decide we didn't like, could we bring in a second vendor and then preferentially direct business that way? Or is this an exclusive contract? Because we're not paying for anything in the contract. We're paying for individual episodes, correct?
Yes.
Okay. Second question is a lot simpler. And that is that I assume that on the septic pricing, where it says Mill City Consulting, that's actually Mill River Consulting. There's not a third vendor in here?
No.
Okay. And the last thing is that there's a little bit in terms of the septic pricing that looks like apples and oranges. The Mill River Consulting tends to have a flat rate that looks higher, whereas New England Classic has lower rates that are per hour with 2-hour minimums, et cetera. Is there a substantial difference in the total pricing for what individual episodes could expect to pay?
Well, let me give you an example. So a deep hole and a perk test could take anywhere from 3 hours to 2 days. So yes, the prices can extend. So if you see on Mill Rivers, it's $700 inclusive. So that could be anywhere from 4 to 10 deep holes. Whereas on the other pricing, it is by hour, and it would be anything over that time frame would be an extended hourly rate.
Okay.
So there is a range.
There's a range, and depending on where they fall, both of these are reasonable. So it's not there's a price advantage, a drastic price advantage for one over the other.
I don't think so.
Yeah. Also, too, just as how do I want to put this? Most of the good land, if you want to call it that, for septic is gone, and therefore, what we're going to be potentially doing on a site for testing and design and whatever is not going to be, the rubber stamp, simple, everything's great, bang, 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 bang kind of thing that you can do very quickly. Say, oh, everything's great here, boom, versus problem, how do I work around it, kind of thing to make things appropriate. So the soils that we have left in town, most of it is pretty poor and is going to be marginal in a lot of cases for a number of different reasons. And therefore, I think the potential for an hourly thing has the potential to cost us more. Simple as that. Cost us more.
Okay.
Or in this particular case, cost the party that's paying the bill. Yes.
Yeah. Okay.
And I think, Erica, going back to your question about the contract, is if we end up being able to do a 1-year contract and make sure that there is a clause in there that says something about you know, any type of dissatisfaction would be, would have to, you know, we would be able to seek someone else or get out of the contract.
Okay.
Anne Maria, you can't hear anybody, or can you hear us? Anne Marie lost her volume.
Oh, okay.
Anne Marie, are you back?
No,
I'm gonna tell her to log out and log back in, see if it works.
okay.
So let me just see if,
And I think that it's fine by me to have a short contract with the option of extension as long as prices don't change. There's contracts out there that obviously if you want shorter, they say, fine, we'll give you shorter, but we're going to up our price 20%.
so that will actually lead us, Eric, and we'll see if Anne Marie can get back in, lead us to the next item on the agenda, which of course is the fee schedule, which we had based on last month when we talked about it. There were some holes in the schedule, which we went back and got updated prices on, which are the ones that are highlighted in the yellow. Let's see if she's back.
Detention.
Are you back, Anne Marie?
Can you hear us?
She still can't hear us. Oh, she's muted though.
You're muted.
No, I'm not.
Oh. She's back.
I'm back.
Mm,
Oh,
yeah.
So do we want to go over this real quickly with Anne Marie?
oh no, I just lost my own link. Hold on. There we go. So, Anne Marie, we just started talking about, well, actually, do you guys want to vote on the contractors first?
I'll make a motion to retain Mill River Consulting.
Do you hear
I'll
us?
second. Go ahead.
All in favor? Aye.
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 And by the way, do we need to qualify that saying that we're going to go for the 1-year contract with a 2-year extension as an option?
Sure.
If it's the same
Well,
price?
If that's okay with Anne Marie.
Well, yeah, we only have to do that if that's a deal breaker, Eric.
Okay.
I mean, I don't think it's a deal breaker, not from my perspective, particularly if there's some language in the contract that lets one party terminate early if they're unsatisfied. I guess we have to see the contract.
And with no, and if we do extend that contract, so say we did go with a 1-year contract and then we were extending it out to 2 years, would like to have some level of a guarantee that the price is not increase.
Right.
Yes.
Well, you could ask for a self-renewing contract,
Yeah, yeah.
absent 30 days notice before the end of the contract by either party.
And I think given what Rich said about the soils and that we're talking about in Chelmsford, that we don't want them to have a negative experience and double the prices next year.
Exactly.
Yeah.
Yeah.
Well,
There's a
let's see
potential.
the contract.
Say it again?
Okay.
I said, let's see the contract.
Okay, so let me just, so self-renewing, this is what I'll shoot for. 1-year contract with a 2-year self-renewing type of thing. No price change within that, with a clause that if there's any dissatisfaction in the contract, we can terminate the contract.
Well, I mean, they're going to want the same out.
Right,
Right, exactly.
Right.
Yep.
So really what it would be, Michelle, it's going to be a self-renewing year to year with fixed rates for 3 years. So we'll automatically go year to year unless one of the parties gives notice of termination. And I think after we get by the first 3 years, then we'll probably be more comfortable.
Yeah, so self-renewing contract year to year with fixed rates for 3 years.
Yeah,
All right, I'll work on that.
Okay. So then that brings us to the pricing,
Mhm.
where we got more clarification on the areas that were missing last month as far as pricing, and those are highlighted in yellow. The other thing that we realized, because we've already gotten, at the health department, we've already gotten our first soil testing request, and it didn't take long. And so with that, we realized that all of the fees that we had listed under the consultant were exactly that, the consultant fees. And we hadn't put anything in there as far as our office administration
our
fees.
admin fees, yeah.
Yeah. So basically, that middle column would be the admin fees, and with the highest one being just the soil testing, and then basically $25. So we're certainly not asking to rob the bank for an admin fee on any of those things. So we would need the board's approval of the Mill River consulting fee as well as the Board of Health fee with the total fees under Mill River.
You know, where it has the asterisk and says health inspector will do the, by health inspector, is that Michelle and
That would be
Mark?
me.
Yes.
Now,
So,
Mark doesn't have a license in soils.
That's Michelle.
That would be me.
so that would be Michelle, but we need the pricing from the contractor, because if it just so happens that Michelle is on vacation, or if she's just totally overwhelmed and she can't do that particular inspection, then we would have Mill River do it
And here's
for
the
us.
reason why
And
for
would-
that. When these contractors are working, they're out there, they're working, they want to move forward. So if someone needed a bottom of the bed inspection, which can take 1-2 hours or what have you, if they need a bottom of the bed, say on a Wednesday, and I don't come back to work on them till Monday, we don't want to make them wait. So that would stop that job right there and then. And so we want to make sure that they're continuing to work. So our goal is to make sure that when someone calls us, we're out there within that day or the very next day. So no more than 48 hours should we make this lapse. So to force someone to wait and stop a job is really unfair to the contractor. It's money. It's time and money.
The price
for
is not 350 versus 25. It's 350 plus 25. The
Plus
25, the
25,
component
yes.
that the health inspector does could be, we could have the Mill River do that themselves. But to have
could.
you be on site,
Right.
is that still just $25 administration fee, or are
So yes, not even. So say, basically, we are not even charging them for my time to go out. I'm there already.
should
So we're just showing you how much Mill River would cost and how much New England Classics would cost
I'm-
if we get to bring them out.
for our fees, should there be a difference between something that's just administration within the office, double checking paperwork, and something that's an on-site visit? So should those fees be twice as much?
There definitely should be a separate fee for Michelle to be going out when the consultant is not going out. Now, again, I think her timing scenario is very accurate, but the idea is that there has to be something in regards to a fee to subsidize it a little bit, okay, so that it balances out where, and again, I don't know if the numbers are going to be that, but we don't want the numbers to be pulling her away from everything else, regretfully, that we're currently in, and we just can't do it. So I think we need a de facto fee of some sort, for her time out in the field, that it shouldn't, very simply, before the other fees that were being paid kind of covered that, when they were paying for the testing, when they were paying for the permits. They were paying for all these different pieces of the puzzle. It sort of overlapped and whatever. But now that it's going to be a little different, I think there has to be some fee. It doesn't have to be exorbitant, but if, and again, I'm just throwing out a number. If Michelle's, hourly rate is blank number of dollars, and there's these kinds of what I call pop-out inspections that take that 1 to potentially 2 hours, that you find some middle ground in what a salary would be for those hours, and that the town isn't absorbing, and again, this whole thing is being sort of put on us when technically the Board of Health was sort of walking away totally of subsurface discharges because we just 100% sewered, and now all of a sudden we're being thrown back to it. So yeah, I do think there needs to be something that somehow relates to the cost of an employee of the department going out and doing these, what I call short-term spot checks. Yeah.
So I would
Yes.
make a recommendation that if we look, so we basically broke these prices down into the 2 columns to give
Right.
you an idea of, what we got for pricing from the 2 different contractors. And what, as we approve this Board of Health fee, we're not necessarily approving a fee for Mill River Consulting. That was used as an example. So what we would ask is that you vote to approve the total fee for those first 3 columns. So my suggestion would be that if you look down to construction inspection, bottom of the bed, and it's a total fee of $375, that's the fee that they would have to pay regardless of who's doing it.
Okay, so
So whether it be Michelle doing it or whether it be Mill River doing it, that's the fee for a bottom of the bed. And, then, but the only thing I think of is that, like, the bottom of the bed, the final grade, the tank inspection, all 3 have to kind of go hand in hand.
right, so so you and I had talked a while back about this. If we were going to make it a decision to charge for my time, it would do a one price for 3 or 4 of these inspections.
Yeah.
In the office inspections, because to continue to charge them, say, $50 for this inspection, $50 for the next inspection, it just brings them back into the office too many times.
Mhm.
If we're going to, and we don't want to break the bank either, so we've got to charge in. Here's your typical way that the pricing will go. The soils will always be with a septic system, so one of those 2 prices at the top. You are always going to have a plan review. You're always going to have a denial on the first plan review, and they're always going to resubmit on a second plan review. So there's going to be 2 at least. And then,
Wow.
so you have a plan review, and it gets submitted, and it is usually
Anne Marie again. Hold on a second, Michelle.
Sure.
Sorry.
Mhm.
Yes, to try to log out and log back in again. We lost her again.
Okay.
She can't hear anything we're saying. What's your recommended price, Michelle, for all 3?
I would say $150, maybe. So
But how
typically,
many hours do you think all 3 of those inspections are going to take?
so a final grade is going to take 30 minutes versus a bottom of the bed could take 1 to 2 hours. And then a tank inspection, again, is going to be less than an hour. So it's not an awful lot. And technically, let me just explain to you the charges that will go along with every single septic system. And I can do that when Anne Marie comes back.
Yeah,
Is she there?
I'm
She's up.
back. Talk fast.
Okay.
Talk fast, real fast.
Here's a given on every single septic system, the charges. They're either going to be a new construction or an upgrade repair. So one of those charges, 700 or 515. Then you're going to add on the initial plan review for $280.
Well, actually, no, you're going over to the total fee. You're going over 755, 40, and 305.
Right, but with the admin fee too.
Right.
So I'm just going down.
Total fee.
Total fee. So you have the 750 or the 540. Then you're going to have absolutely the 305 for the initial and the revised submittal for 165, just the next paragraph down. You're going to have the the bottom of the bed for 375. Well, again, the bottom of the bed would be me, so that's going to be an admin fee, Susan. But these are the things that are always going to be in it. So the resubmittal, the bottom of the bed, the final construction, the tank inspection, and the final grade. So all of those inspections or plan reviews are always going to be in it. So you're getting up there in price if you charge them $375 for my time on a bottom of the bed, or $375 my time on a final grade. Do you know what I mean? That's an awful lot of money. It's exorbitant, I think.
So Michelle, I got
my own opinion.
I just have a quick question.
Yep.
So how do we charge somebody Mill River's prices when you're on vacation, but when you're not on vacation, they pay less
No,
money?
bill less. So less money for, you mean, so
we-
Mill River's always going to bill us.
No, I understand that, but what we have on these fees, because it's the fee schedule that we're going to update, right?
Right.
So the fees for the plan reviews where you have the asterisks that you would normally be doing,
Right.
right? We're saying a lesser price, but if
Right.
you're on vacation or unable to go, then that resident or property owner is now going to have to pay Mill River's prices.
No, Donna,
How is
Donna.
that fair?
no, Donna, what normally happen in other towns that I've seen is basically when someone potentially goes on vacation or whatever the conflict is and whatever, they have an option, because she gave an example. They made a request on Wednesday and she wasn't going to come back till next Monday.
Mm-hmm.
They call up and say, we want an inspection tomorrow. And you sit there and say, sorry, our inspector is out because of A, B, and C. But if you want to pay an extra blank, which would be the additional fee for Mills, the consultant to be there, then they can choose, or they can choose to wait. They don't have to pay the extra money, but they're going to have to wait. If they don't want to wait, they pay the extra fee. And I've seen this happen in a number of towns where you sit there and go, well, I don't want to wait. Well, then it's going to cost you this. Sorry, we're not 100% available to you at every second of the day. So bottom line is, you can choose to wait till the party's back, or the consultant will come out and get it done for you. But here's the charge to the consultant. You choose. We're not forcing anybody to pay a higher fee or a lower fee.
So that makes sense. So I think the fee schedule will have to be written a little bit differently
Yes.
based on that versus it being, here's the flat rate that we're approving tonight, because that's not really the case then.
And remember, this is, our season is only open from probably, March until the end of November or so. So this is not throughout the winter. It's a, 6-month season. And we do try and alert people all the time, whether or not, if I was to be away, I would be alerting them, letting them know that I was going to be away, and this is how it was going to happen.
So I would recommend that we approve the total fee column. Donna, is there a call-in, because Anne Marie lost her sound again? Is there a call-in number where she can call in? Is it in that email?
It is in the email. I can,
Let me see.
if you have her cell phone number, I can have you text it to her. Oh, she's in. Can you hear us, Anne Marie?
No, she can't.
She can't.
All right, let me go back. Let me go back to the link.
Sure.
Yeah, there was a call-in number, right? New York, or whatever it called.
Correct, yeah.
Right, yeah.
Oh, all I see is the updated link.
Here, it's one, I don't know if you want to write it down or
Hold
text
on,
it to
yeah.
her.
Hold on one second. Oops.
Is this the 929 number?
It is, yes.
Yeah, what is it? 1929?
205-6099.
All right, 1929-205-6099.
She may need the passcode of 424521. Or if she has Zoom already, a Zoom link on her phone or tablet or whatever, she could just click onto the Zoom app and put in the meeting ID and password,
All right, so the passcode is what, 424?
521.
Never had issues before.
Is she on Comcast or something else?
I wonder if she needs to update her Zoom link app, if that's what she's using.
Yeah, I don't know. All right, so I'm sure she's gonna try to call in and change what she's doing.
We just hear her move her seat.
We just heard her
We
move her
did.
chair.
Anne
What?
Marie? So we can hear her, she can't hear us.
Wow.
Hmm.
Is there something, Donna, on your end as mute or unmute?
No, I mean, I can mute everybody, but I can't mute an individual.
Sounds good.
And I'm sure you'd like to do that sometimes.
Not on this call.
I can hear her.
I know.
Yeah, Marie,
She's
we can
mad.
hear
She's
you.
mad. That's why.
Can you put her on speakerphone, Sue?
I don't know.
Try calling her and putting her on speaker.
Yeah, maybe. It might work.
Might be able to do that.
She's trying to call in right now.
It's funny that we can hear her.
I know. She might be saying.
Obviously voyeuristic.
Yeah.
We should say something. If she's logged in, we don't say anything.
Yeah, then if we're not talking, she'll go, what? I got nothing.
Anne Marie?
There you are.
Are you on the phone? What?
Can you hear us now?
I'm hearing her speaker click on off.
I'm
She's
back.
muted.
Back.
Now
Hang
you're
on.
back.
The meeting
You're back.
ID didn't work.
She's on two screens.
So, Anne Marie, you need to disconnect one screen.
I don't know how to do that.
So you're on your computer.
Hold on, I'm gonna mute you on one of them.
Yeah, mute one.
Mark.
Can you hear us now?
She
Now
has to
she-
unmute herself.
She has to unmute herself now.
Can you hear us? There she is.
No, I went for my house phone.
There you are.
All right. there you
We're
go.
gonna hear you.
She's back.
Otherwise, we're gonna use sign.
Now,
Let's vote.
Okay,
I can't, now I can't, you're garbled.
Jeez.
question for
Right.
Michelle. Did you say that
I'm gonna
all-
call in. Because this is crazy.
Okay.
Did you say that all plan reviews
I'll
are?
be here all night long.
I think, Michelle?
Yes.
All right, now I can hear you.
Okay.
Okay,
Are you
Can you hear-
connected in two formats, Anne Marie?
We lost her again.
She can't hear us now. Anne Marie,
Oh.
can you hear us? No. All right, I'm gonna just call her. Oh, there she is.
Yeah, I heard her laughing. Yeah, see if you can do a speaker. Better than feedback.
All right,
She has to
I'm just gonna-
unmute. She has to unmute now. She's on mute.
unmute yourself and I'm gonna try to put you on speaker.
We can hear you.
Oh, we can
Oh.
hear you. Can you hear Anne Marie?
I just did, but I think it was through her phone.
It was through the phone. There she is. There she
I can
is.
see Dawn,
Okay, you're good now.
but I cannot hear anything.
Talk?
All right. Disconnect yourself from there and I'm gonna try to put you on, I'm gonna try to just put you on speaker on my phone.
Okay, I'm going to leave the meeting now.
Yeah.
Yeah, okay.
Okay.
All right.
Anne Marie, can you hear us? Sue, you're on mute.
You're
You're
on.
on mute.
There you go.
There.
All right, now you've got both of us. Anne Marie's on the phone with me.
Okay.
Okay.
Okay, Dr. Miko, you had a question?
Sue, you said that all initial plan reviews are rejected?
Yeah, so usually there's missing information. So every plan they'll take in the plan, it's a very good engineer that gets it on the first round. So, and that happens with all of our plan reviews because the customer has missing paperwork or has something missing on the plan that's required by Title V. So hence the secondary, revision.
Revised submission.
Yes.
Okay. Okay, so it's possible, it's just rare. And in terms of the total prices, am I hearing that the total price is fair, given what Mill River Consulting charges, that you don't think it would be appropriate for us to increase your fees for doing on-site visits when you're talking about 4.5 hours of your labor?
Not to this level.
What-
Not
what if we do a
$375.
recommended- What if we do a recommended fee of either $150 or $175?
Yes.
Right.
Yes.
I agree.
If Michelle does those tank inspection, bottom of the bed, final grade.
Right.
175? So, and that would be for the they would still have, like, going back up to soil testing, new construction, that would still be a $50 fee. We would just take all, or are we saying that everything that the Board of Health does, the Department of Health, everything that Michelle is a flat rate of 175 for these from beginning to end?
Yeah.
No.
Oh, I thought that's what you were saying. I'm
Just
sorry.
for those.
Admin
so
has to
for the
go.
tank inspection, the bottom of the bed and the final grade,
Right.
for Michelle to do those, that fee is $175.
Instead of 75.
And then we look at the total fee line above and we vote to approve all of the total fees that are under column 3. So soil testing, new construction, $750, upgrade, $540, plan review, initial, $305, pump system review, $305, pre-treatment system, $305, plan review for revised, $165, and so on down that line. And
Anything
then,
that's not asterisk.
and then for the asterisk, it's one fee of $175 for the health department to do it. And if they choose to have Mill River do it, they pay the other fee.
Correct.
I'm okay with that. I'm also okay just doubling those 3 fees that have health inspectors. So it'd be 150 total as opposed to 175.
Anne Marie, why are you beeping?
She's not happy.
Michelle, what was the price for the other towns to do all three of those things before?
They don't charge.
What do they charge for then?
They charge for the consultant to do it.
Oh, so they're not doing it themselves? Or,
Right.
No, very rarely does a town do it themselves. Now, Westford does. They have a person that's on site that does only septic. So, and they have their fees, and you saw those fees the last time that you approved. It was on Westford does it themselves, but most towns have a consultant.
And clearly, I think the consultant scenario, even though it seems higher, if there's not enough work to quote unquote have a new employee be exclusive like Westford does, which by the way, Westford, because they're 100% septic, clearly does have the demand for it,
Right.
and therefore they have a new employee doing nothing but that makes sense. But for us, with 1%, kind of scenario left, for us, it doesn't make any sense at all to. And again, I'm not knocking to have a new employee, but the fact is, it wouldn't make any sense to have a new employee just for that exclusive use and not just through the consultant.
So, what are people's thoughts about, do we want like a flat rate for three things of 175 and put that in a line item like that? Or would people rather just double up the 25s, make each of those three lines 50?
I mean,
It's a difference,
go ahead.
just a difference of $25.
It's apples and oranges. I think the range in either scenario is fine, whether it's 175 or, like you said, 200, whatever. Either way will work. It's just the semantics of how you want to put it down on a piece of paper.
And my main reason for thinking about it, we're talking about three separate events, which
Right.
means y'all can go to one and she can't go to the other two. Did they already pay the 175 and now they got to pay the Mill River? Or do we just sort of like give a price for each of the three different events, the three different site visits, and just sort of bring it up close to the range? $25 for administration and $25 for being on site for each of those, for a total of 50 for each.
Okay.
Does Anne Marie, can she still hear us?
So
So much of this discussion, I'm not comfortable weighing in. Here's the one thing I will say though. If we charge a fee for Michelle's time, is that coming to the Board of Health or is that going to the town?
It's gonna go to the town.
always has.
How are we helping ourselves here?
We're only helping ourselves when budget time comes and we sit there and say, we brought back a reasonable comparison of monies towards her hours versus the fees that we collected. That's about it.
And the
This
change
is the
in
one-
compensation that Michelle's gonna need for doing this actual work, because we're gonna have to update the job description and all that, because it wasn't in her initial job description.
Right.
But we're talking about, so few, we're not really anticipating a lot of projects, correct?
I don't think so, but I might be wrong, but I just don't see we have the land left.
So I'm putting septic in right now.
I know where you live.
There was a little discussion today about another property too.
Yep. Yeah, no, there's properties out there, but I don't want to go backwards, but when I first got here, we were 100% septic.
Yeah.
And
The problem is we have no way of knowing what the impact is gonna be. The next year, we do have another property coming forward that's gonna involve septic as well, that we just heard about.
Well, and if I recall, so the people that are already on septic as well, they now have an option to, if they have a failed septic, to replace their septic systems as well if they
Technically.
choose not to tie into sewer. So there are, what, 30, 40 people that are on septic right now.
Right.
And
course.
businesses that, I don't think there's businesses that are even on our list that
No.
are on septic at this point.
No, there isn't any businesses on septic.
Right, so
that
there's
I'm
many
aware of.
businesses out there in Chelmsford that are on septic
Right.
and are on very, very old septic systems and that have chosen not to tie in.
Yeah, but I think, I hate to put it this way, but I think if people are thinking about it financially, anybody that chooses to continue to go on septic when the sewer option is available, particularly with the new added cost that has come up with the design and what they're going to have to do if they want to upgrade, and the money that we're going to charge them, they're going to be charged like everybody else. They're not exempt from the consultant's fees. That the option to then go to a sewer connection, they'd be out of their mind to choose a subsurface scenario.
There's
Correct.
already a connection available to them.
Right. I mean, they'd be out of their mind. I mean, maybe there's a few that'll choose that, but I just can't see anybody, once they see it in black and white of where things are going for the future, that anybody would choose something that may cost 3, 4, 5, 6 times more than it would be to tie to the sewer that's sitting in front of their property.
Okay,
That's my opinion. I mean, who knows?
All right.
I
So
would
the
like,
final decision, 1 fee or 3 separate charges?
3 separate
Well-
events. I prefer 3 separate charges, and I prefer just doubling what's on here right now.
Okay.
And unless anybody has a strong opinion, I'd like to make a proposal that we approve just that, which means we're going to change those 3 lines to be 50, 50, and 50, which means that the total fees will then go up from there. And I'd like to propose that we accept that.
Okay.
I'll second that. I mean, I think we need to, to move on, and everybody knew that this scenario of going backwards is not going to be what I call these are all potentially, we're going to be dealing with all new construction, and they can make a choice on whether it's financially workable in town to go forward with a project or not, depending on what the charges are to, for the development. So
Okay.
they have that choice up front. We're not forcing anybody to do anything.
Sue, could you double check if Anne Marie heard that and if she's comfortable with it? And then we can take a vote.
Emery?
I'm here. I'm going to abstain from any vote. I just haven't been able to follow this.
Okay.
Okay. I'll take a vote. Aye.
Aye.
Okay.
Abstain.
Abstention.
Okay.
Oh dear. Okay. Next item is new business.
You need to vote to accept old business, Eric?
Oh, sorry, to accept old business in its totality.
I'll make a motion to accept all business in totality.
Second it. All in favor? Aye.
Aye.
Thank you. New business.
So new business, we just wanted to bring up the idea that, with all of the changes that are happening right now with subsurface sewage disposal systems and the whole Title V and the moratorium and everything that's on the table at this point, the Board of Health, because the town of Chelmsford had essentially been a fully, for the most part, sewer town, has not had to update the subsurface sewage disposal regulation, I believe, since like 1995. So we are in the process of gathering regulations from surrounding communities who do septic all the time. And the Board of Health will be putting forth a draft regulation that should be ready for the next meeting. the beginning of December so that we can have a public hearing on those draft regulations, and then hopefully, after that public hearing, vote on accepting the updated regulations. Because clearly 1995, a lot of things have changed at the state level regarding requirements.
Mhm.
So that will take place at our next meeting, as far as reviewing that draft and having the public hearing.
Okay.
Yeah, I mean, clearly, the regs haven't been updated, and clearly the regs that were generated back then were actually even before the last change in Title V. So that some of the different things that we have in it, there's some conflict with Title V as it stands today. So as a minimum, we have to clear those things out, but I think we need to look at the whole package together and come up with a, with a reg that deals with everything that the future is going to bring in a totally new scenario for subsurface, final discharge to the ground and not being tied to sewer. So.
Okay.
So as I said, I think it's just a matter of, the board understanding that that's what we're heading for next meeting, is to try to put a new regulation together that kind of smooths some of those things out that someone's not looking at and say, well, wait a minute, that's a conflict, but this one's this, and this is a stricter and this, that, whatever. It just makes the transition smoother for
Okay.
where we're going as next year begins. Hopefully we'll be, having something in play that will look like it should be there, which we never expected that we're going to still have it. But that if this is the new scenario, then we need to have something in play. So.
Okay. And discuss fees for repeat COVID enforcement inspections.
So that refers to last month when we approved all of the other fees. Anne Marie had mentioned that we should actually implement or discuss implementing a fee from the Board of Health perspective for a reinspection of particularly businesses that we are getting repeat complaints on as far as violations against the Department of Labor standard guidelines as far as COVID enforcement. So that was why we have some businesses that we've been out to 3 and 4 times, for a mask violation, whatever. I don't know if at this point, thinking about the governor's updated order today, where it's a little bit, it's definitely stricter.
They have $300 or $500 fees on there. And the other problem is that if we charge for inspections, then we're charging based on complaints, whether we've substantiated it or not.
So I think this would be more of a fine, Susan, not a charge for inspection.
No,
Correct.
no. So the fine would come from the governor's order.
Right,
The money from that fine goes to the general fund, to the town.
right. It all goes to
The
them.
fee would be a fee that we would be charging the business because we've had to send an inspector out there 3, 4, 5 times for the same issue.
Right. So we're not calling it a fine.
Nope.
We're calling
A
it
fee for reinspection.
for repeat inspection
Yeah,
on the same thing.
yeah.
Okay,
And again, my
so that's
fear is that somebody, if you had somebody calling in phony complaints, that
So it
you-
would be based, it would actually be based, it would have to be based on the inspection, because we've had people call and complain and
Mhm.
about different facilities, different businesses, whatever. We've been out there. We go out there one time, we walk in and walk through the door and everything's fine. They've got their masks on, they're doing what they're supposed to be doing, and we don't find any violations. Then a week later, 2 weeks later, we might get another complaint regarding the same place of business, and we do another pop visit, and we go in and everything is like the complaint said. So it's sometimes it's just a matter of how you catch them and what time of day.
So can we qualify this not just for inspections, but for inspections that substantiate the charge or the claim?
We could. I don't necessarily feel like if it's the first time we're getting a complaint. I mean, I'm a little reserved on this only because there's one part of me that says the number of complaints that our department is getting and the number of times that we have to follow up with phone calls, that we have to follow up with in-person inspections to these different places of business is absolutely absurd. And the staff is beyond capacity at this point trying to do these enforcements, when I firmly believe that the onus is on the business to know what the regulation is. It's up to the manager of that business to enforce the regulations and enforce the orders from the governor. And when we have to repeatedly go out, that's when it gets frustrating.
So what kind of fee would you propose?
And can I interject for 1 second too? This isn't, I don't think, based on 2 complaints at one facility.
No.
This is based on 5 complaints at one facility, one that we have to continuously go back into. So 2 is not our number. I think 5 is like our, and I don't want to put a number out there. I just want to, I think what Susan's saying is that just the repetitiveness and the times that we're getting it and how many, that's what it's about. It's not about a couple inspections we're going out over the course of 10 months.
Because our ultimate goal, every time we go out on a complaint, the ultimate goal is education. And to re-educate the businesses, the owners, the managers, whoever in charge, why these orders are in place by the governor and why they need to comply and that type of thing. We're not out there to make enemies. We're out there to just try to completely educate on best practices based on what DPH and CDC has out there. But we do have certain businesses that we have been out to so many times, it's ridiculous.
And it's complaints that are valid. This is with validity.
Right. Are you talking about $100 fee?
That was my thought.
So let me just a question with Governor Baker's announcements today, where he talked about any mask violation was going to be a $300 fine. So if we have to go out on an inspection, because the complaints are all around the masks. So if we're going out on an inspection and we find that it's real, wouldn't that be the governor's fee, the $300?
That would be, yes, if we choose to impose. So if
And
we have the right
to eventually,
we have the right to impose that fee.
So we could
that
actually
fee would then go to the town
you're looking for the other fee to go to the Board of Health.
for continued re-inspections.
So I guess maybe, would it be, we could send an email out to all of these businesses with the governor's guidelines, and the $300 violation fee would be their first time we go out, it's $300 because they have that mask violation. If we have to go back out again based on an inspection because of that, would it be then an additional 100 inspection fee?
No, so that's why I'm saying, I'm wondering, because he just came out with this today, I'm wondering if we just hold off I mean, that money doesn't come to us, but by all technicalities, if we got a complaint and we went out and we issued the fine, the $300 fine, and then a week later, we get a same complaint and we go out again and we find it valid, we can issue another $300 complaint, another $300 fine.
So I would,
Maybe we educate again. We put it out there to the businesses, reminding them that this is the fine that you could be fined per the governor's order, and hope that that people comply. The other thing that I have had to do most recently in the last 2 weeks, which I hadn't been doing up to this point, but I'm actually on certain businesses, I'm actually escalating the complaints to the Department of Labor Standards, because we don't have the capacity to keep going out.
What kind of places are you having these trucks at?
Yeah.
Certain restaurants,
Restaurants?
gyms, places, specific places of business. Unfortunately, a couple of different medical offices that we've had multiple complaints, the same complaints. It's incredibly frustrating, especially when it's coming from medical offices. And they're legitimate. We go out there and we find exactly what the people are talking about. A waiting room loaded with people. People, lined up at the checkout, not social distancing. I mean, it's very frustrating.
Okay.
So, maybe what we do is with the new governor's order, we see how that plays out, and if we need to, we revisit it again.
I would just table it a month at least.
Okay.
My fear is that if we combine multiple fines and then we start selecting that we're going to let you pass this time, and this time we're going to charge you 300, and next time we're going to give you our 100, it's going to seem arbitrary and potentially self-serving by some people. We need to make sure that we're consistent.
Right.
And
like I said, the ultimate goal is not to fine. The ultimate goal is to educate people.
right,
But
to have people hold to curb behavior.
yeah, and
educate.
people need to educate themselves, and then the people that call and lodge the complaint, if we don't have the capacity to go out and follow up, they're calling us back or emailing us back a couple of days later. Well, why haven't you followed up? Or what did you find out on this complaint? And then in some situations we have to say, well, sorry, we didn't get to it. We haven't gotten to it yet, because it's physically impossible to do them all.
Okay, so we're not going to take any action on this now. We can revisit it next month. Do I hear a motion to accept new business?
A motion to accept new business.
Second? I'll second. All in
Okay.
favor?
Aye.
I don't know if you can
Henry
wait
said
here.
aye.
Oh,
Okay.
wonderful. Perfect. Okay. Next is other. But there's a flu clinic. Do we give people like a little card that says you got your flu shot, or do they just get a shot and walk away?
Get a shot and walk away. Right now,
Okay.
we're getting a lot of requests. That we did have a fair number of people that came through the October 20th flu clinic, kids that were school aged.
Yeah.
And of course, at the time, they forgot to ask for a copy that they need for the school.
Mm.
But so we're getting those phone calls now to give the parents copies. But by all technicality, once we get them into MIIS, the school nurses have access to MIIS, and they could see that the
Okay.
student had the vaccine.
So we do require, at least is that just for the kids, or is that for all in MIIS?
Everybody goes into MIIS.
Okay. Okay.
Good.
I have to tell you, when I was typing up my monthly report the other day, I said, man, I'm looking at this report. This does not reflect how insanely busy this office is. And the number of phone calls and everything.
Your paper's not barking at you.
It's disappointing.
Yeah.
Yeah, But the bottom line is you don't have the time to write up as
That's what I
long
said to Donna.
because you don't
I
have
don't
the
even
time to
have
do it.
I said, Donna, I don't even have the time to write this thing up.
So it's like you lose.
Well, I know I've called you that there's times that I will put a phone call and I'll get a phone call back at like 8:30 at night or something. So yes, I know that there's a lot of these things that might be a one-liner
Yeah.
that had taken up 2 weeks of your life.
Yeah.
So thank you. And at least you know that you are essential.
Yeah. Doesn't that make you feel better?
Oh, yeah.
I'm essential. Oh, good.
Yeah, right.
You're needed and you're loved and appreciated. So,
A warm and fuzzy inside, Dr. Meikle.
There it is. There it is.
okay. So do we need to accept then the other category also? I will take a motion.
A motion to accept others.
Does Anne Marie want a second?
Anne Marie, you want a second? Anne Marie seconded.
All in favor? Aye.
Aye.
Okay. And so unanimously approved. And now, Donna, can we open up to public input?
Yes, we have one person on, John Dearden, if you'd like to speak. If you could unmute yourself.
Thank you. I've heard all I need. It's very interesting. Thank you.
Have a good evening.
Thank you for
Thank you.
tuning in.
Okay. If there are nobody else to speak at public input, then I'll close that now. And we don't take a vote on that, do we?
Question for you.
What was that?
Anne Marie has a question for you.
Fire away.
How did the presentation before the select board go last month?
Did you hear her? How did the presentation before the select board go last month?
Now I got to remember it now.
The squishy wording.
The squishy wording, that's right. Actually, you did a really good job.
Yeah.
I
that was
my
hilarious.
recollection is that it was just concise, and then I'm like, yeah, that's a bad word to use there to say, was it relative or what was the word?
Reasonable.
Reasonable.
And so that they said, yeah, we should probably take that and submit it as a friendly amendment. And they put it to Paul Haverty. And then he defined it saying basically that it was going to kick it back to the Board of Health and said these are only we've asked to put in a sewer or wherever it was, so that the selection would be based on who we had asked in the first place. And it went to the town. So at the Board of Selectmen meeting, they were receptive and didn't really question it or interrogate me.
But they didn't change it.
They did.
They did.
They defined the word in the bylaw.
They added within parentheses.
Yeah.
Referencing the Board of Health as the arbitrator. And it was done not in the subject because I don't think they could change the warrant article there. I think it was added in as a friendly amendment at the meeting itself.
Yeah, at town meeting.
Okay.
It had already gone to print, so the change was made at on town meeting floor.
Okay.
Okay.
All right.
Great.
As to our next scheduled meeting on December 7th, are we expecting that will probably be at Town Hall?
It was supposed to be, and then Donna heard from Pete today that room is not going to be set up in December, but it should be ready for January.
So we may be on Zoom again next month.
We
Correct.
will be, yes.
Okay.
Maybe
Okay.
it might be in time for us all to get vaccinated.
There it is.
Yes. So with that, I will take a motion to adjourn unless anybody has any further comments.
I'll give a motion to adjourn.
Do I hear a second? Anne?
Second by Anne Marie.
Are all in favor?
Aye.
Everybody stay healthy and don't dine with your friends.